Did you know one of the pills you take every day could be quietly stealing your memory? Every minute, another older adult begins experiencing the first signs of memory decline. Many people assume it's simply part of getting older. But what if that's not the whole story? What if one of the biggest threats to your memory isn't aging at all? What if it's sitting in your medicine cabinet right now? Millions of adults over 60 faithfully take medications every single day. They trust them because they're common, easy to find, and often recommended to treat everyday problems like allergies, heartburn, trouble sleeping, bladder issues, or anxiety. But recent research has raised an important question. Some medications may affect the brain in ways most people never expect. Certain drugs have been linked to reduced mental sharpness, confusion, slower thinking, and in some studies, even a higher risk of cognitive decline when used for long periods. The surprising part? Many people have never been warned. Today, we're counting down 9 medications that deserve a closer look if you're over 60, and stay until the end. Because the number one issue isn't actually a single medication. It's a combination that millions of seniors are taking every day without realizing how those drugs may work together. Before we begin, I'd love to hear from you. What medication do you take every day? Have you ever noticed brain fog, forgetfulness, or trouble concentrating after starting a new prescription? Leave a comment below. Your experience could help someone else. Now let's begin. Number 9, diphenhydramine, common sleep aids and allergy medicine. If you've ever struggled to fall asleep, or you've reached for allergy medicine during spring, there's a good chance you've taken diphenhydramine. It's sold under several different brand names and is also found in many nighttime cold medicines and sleep products. Because it's available without a prescription, many people assume it's completely harmless. But your brain may see it differently. Diphenhydramine belongs to a group of medications known as anticholinergics. These medicines block acetylcholine, one of the brain's most important chemical messengers. Acetylcholine plays a major role in learning, memory, focus, and attention. As we age, our natural levels of this chemical gradually decline. Blocking even more of it may make it harder for the brain to work efficiently. Some people notice this almost immediately. They wake up feeling unusually groggy. They struggle to remember simple things. They lose their train of thought during conversations. Others don't notice the changes because they happen very slowly over months or years. Several long-term studies have found that frequent use of strong anticholinergic medications is associated with a higher risk of cognitive decline in older adults. That doesn't necessarily mean the medication directly causes dementia, but it's enough to make many experts recommend avoiding regular use whenever possible. So what can you do instead? If you're taking diphenhydramine every night to help you sleep, it may be worth talking with your healthcare provider about safer alternatives. Simple changes like improving sleep habits, limiting caffeine later in the day, or using medications that don't affect acetylcholine as strongly may be better long-term options. The important message is this. Just because a medicine is sold over the counter doesn't automatically mean it's harmless for an aging brain. Now let's move to another medication that's sitting in millions of kitchen cabinets. This one doesn't target the brain directly, but it may quietly interfere with nutrients your brain depends on every single day. Number 8, proton pump inhibitors, heartburn medications. If you've dealt with acid reflux or chronic heartburn, you've probably heard of medications like omeprazole or esomeprazole. These medicines can provide tremendous relief. For many people, they seem almost miraculous. One pill, no more burning, no more discomfort. The problem begins when they stay on them for years without ever reviewing whether they're still necessary. These medications work by dramatically reducing stomach acid. That helps control reflux. But stomach acid also serves another important purpose. It helps your body absorb key nutrients. One of those nutrients is vitamin B12. Vitamin B12 is essential for healthy nerves, proper brain function, and normal memory. Without enough of it, people may begin experiencing fatigue, difficulty concentrating, numbness in the hands and feet, and increasing forgetfulness. Some studies have suggested that long-term use of proton pump inhibitors may be associated with lower vitamin B12 levels and a greater likelihood of cognitive problems in older adults. Researchers are still studying exactly how strong this connection is, but many healthcare professionals now recommend using these medications only for as long as they're truly needed. That doesn't mean you should suddenly stop taking them. Stopping abruptly can actually make acid reflux worse. Instead, speak with your healthcare provider about whether a lower dose, a different medication, or lifestyle changes could help manage your symptoms safely. Sometimes simple habits make a surprising difference. Eating smaller meals, avoiding late-night snacks, losing excess weight, or raising the head of the bed a few inches while sleeping. These small adjustments may reduce the need for long-term medication while supporting both digestive and overall health. But the next medication on our list may surprise you even more. It's prescribed specifically to improve quality of life. Yet it may also affect one of the brain's most important memory systems. Now let's continue with a medication that's commonly prescribed for a very personal issue. Many older adults depend on it every day. Few realize it may also affect how clearly they think. Number 7, oxybutynin, bladder control medication. Frequent bathroom trips can make everyday life frustrating. Whether it's long car rides, shopping, or simply trying to sleep through the night, an overactive bladder can seriously affect your quality of life. That's why medications like oxybutynin are so commonly prescribed. For many people, they seem like the perfect solution. But there's another side to the story. Like diphenhydramine, oxybutynin also belongs to the anticholinergic family. That means it reduces the activity of acetylcholine, the same brain chemical responsible for learning and memory. Unlike some medications that stay mostly outside the brain, oxybutynin can cross into the central nervous system more easily. Over time, some older adults report symptoms like difficulty concentrating, slower thinking, forgetting names, misplacing everyday items, or feeling mentally foggy. Several large studies have found that long-term use of strong anticholinergic bladder medications is associated with an increased risk of cognitive decline in older adults. That doesn't mean everyone taking oxybutynin will develop memory problems, but it does mean it's worth having a conversation with your healthcare provider if you've noticed changes in your thinking. Today, there are newer treatment options that work differently and may have less impact on the brain. For some people, bladder training exercises, pelvic floor therapy, reducing caffeine, and limiting fluids before bedtime can also improve symptoms. Sometimes the safest solution isn't adding another medication. It's finding a different approach altogether. Now let's move to a medication that millions of people take to protect their heart. Ironically, some researchers believe it deserves a closer look when it comes to brain health. Number 6, statins. If you're over 60, there's a good chance you've been prescribed a statin. These medications are widely used to lower cholesterol and help reduce the risk of heart attack and stroke. For many people, they're an important part of treatment. And it's important to understand something. Statins save lives. That's why they continue to be recommended for many patients. However, researchers have also explored whether certain statins may affect memory in some individuals. Why? Because cholesterol isn't just found in your arteries. Your brain also relies on cholesterol. It's an important building block for nerve cells and helps maintain healthy communication between brain cells. Some people who start statins notice temporary symptoms like difficulty remembering words, mental sluggishness, trouble focusing, or feeling less mentally sharp than usual. Large studies have produced mixed results. Some show little or no effect on cognition. Others suggest that certain people may experience temporary memory-related side effects. The good news is that these symptoms often improve after discussing treatment options with a healthcare provider. Sometimes adjusting the dose or switching to a different statin may solve the problem. The key takeaway isn't to stop taking your medication, it's to pay attention. If you notice changes after starting any new prescription, don't ignore them. Your brain deserves the same attention as your heart. And speaking of medications that affect the brain, the next one works directly on your nervous system. Many people take it for anxiety or sleep, but experts have warned about using it for too long. Number 5. Benzodiazepines. Everyone has trouble sleeping once in a while. Stress, loss, pain, life changes. It's understandable why many people turn to medications for relief. Drugs like lorazepam, diazepam, and alprazolam can be very effective in the short term. They calm the nervous system quickly. They reduce anxiety. They help people fall asleep. But the longer they're used, the more concerns begin to appear. These medications slow activity throughout the brain. At first, that calming effect feels helpful. Over months or years, however, some people begin noticing something different. Slower reaction times, poor concentration, difficulty forming new memories, increased daytime drowsiness, greater risk of falls, and reduced mental sharpness. Research has consistently shown that long-term benzodiazepine use in older adults is associated with higher rates of cognitive impairment. Another challenge is that these medications can become difficult to stop. The body gradually becomes accustomed to them. Stopping suddenly may lead to withdrawal symptoms, which is why any changes should always be made gradually under medical supervision. Today, many experts recommend using these medications for the shortest time possible whenever appropriate. Non-drug approaches such as improving sleep habits, relaxation techniques, regular physical activity, and cognitive behavioral therapy have helped many people sleep better without depending on long-term sedatives. But now we've reached the top 4. And the next medication is one that many people never suspect could affect memory at all. We're down to the top 4. These are medications that many older adults take every day without ever imagining they could influence memory, focus, or mental clarity. The next one has been around for decades. It's often prescribed for more than one reason, and that's exactly why so many people never question it. Number 4. Amitriptyline. Amitriptyline was originally developed as an antidepressant. Today, it's commonly prescribed for nerve pain, chronic pain, migraines, and even insomnia. For many people, it works well. But it also has one characteristic that deserves attention. It has strong anticholinergic effects. That means it blocks the same brain chemical we've already talked about, acetylcholine. And by now, you've probably noticed a pattern. Several medications on this list affect the brain in the same way. Individually, each one may seem harmless. Together, they may place a much greater burden on memory. Some older adults taking amitriptyline report feeling mentally slower than usual. They struggle to remember appointments. Finding the right word suddenly becomes difficult. Conversations feel harder to follow. Because these changes often happen gradually, they're frequently blamed on aging itself. But sometimes the medication may be playing a role. Researchers have repeatedly found that long-term exposure to medications with strong anticholinergic activity is associated with poorer cognitive performance in older adults. Fortunately, there are now newer treatment options for many of the conditions amitriptyline is used to treat. If you've been taking it for years, it's worth asking whether the benefits still outweigh the risks. Never stop the medication on your own. Instead, discuss your options with your healthcare provider. Sometimes a different medication or even a lower dose may provide similar relief with fewer cognitive concerns. Now let's move to number 3. This medication surprises many people because it belongs to a class that's often considered modern and relatively safe. Yet one specific drug stands apart from the rest. Number 3. Paroxetine depression and anxiety become more common as we get older. Life changes, retirement, loss of loved ones, health challenges. There's no shame in seeking treatment. In fact, treating depression is incredibly important because untreated depression itself can affect memory and concentration. But not every antidepressant works the same way. Paroxetine is unique among many commonly prescribed antidepressants because it also has noticeable anticholinergic activity. That means it may affect memory differently than several other medications in the same class. Some studies have suggested that older adults taking paroxetine may experience greater difficulty with attention, short-term memory, and mental processing compared with those taking certain alternative antidepressants. Again, this doesn't happen to everyone. Many people take the medication without noticeable problems. But if you've started paroxetine and later found yourself becoming unusually forgetful or mentally sluggish, it's worth bringing that up during your next medical appointment. There may be other options that fit your needs while placing less stress on cognitive function. Your emotional health matters. So does your brain health. The goal is finding the treatment that supports both. Now we've reached the final two. And these are the ones that often have the greatest impact on older adults. One of them isn't even prescribed for memory problems. In fact, it's sometimes given to people who already have them. We've reached the final two. These medications deserve special attention because they're often prescribed during some of the most difficult moments in a person's life. Yet many families are never fully informed about their potential effects on the aging brain. Number 2, antipsychotic medications. Drugs such as quetiapine, risperidone, and olanzapine were originally developed to treat serious psychiatric conditions. But over the years, they've also been prescribed to some older adults experiencing severe agitation, hallucinations, or behavioral symptoms related to dementia. In certain situations, these medications can be necessary. They may help protect both the patient and the people caring for them. However, they should never be viewed as harmless. These medications work by changing the activity of important brain chemicals involved in thinking, motivation, movement, and behavior. For some older adults, they can cause excessive sleepiness. Others experience slower thinking, reduced alertness, less engagement with family, or difficulty participating in everyday activities. Large clinical studies have shown that antipsychotic medications should be used with great caution in older adults, especially those living with dementia. In fact, healthcare providers are encouraged to prescribe them only when the potential benefits clearly outweigh the risks. Whenever possible, many experts recommend trying non-drug strategies first: a quieter environment, consistent daily routines, treating untreated pain, improving sleep, making sure hearing aids or glasses are working properly. Sometimes what appears to be agitation is actually discomfort, confusion, loneliness, or poor communication. Addressing those underlying causes may reduce the need for powerful medications. And now we've reached the most important point on today's list. Surprisingly, it isn't a single medication. It's something millions of older adults experience without realizing it. Number 1. Taking multiple anticholinergic medications at the same time. Imagine this. You take one medication to help you sleep, another for bladder control, one more for allergies, and another for chronic pain. Each medication seems reasonable by itself. Each was prescribed for a different problem. But here's what many people don't realize. Several of those medications may all be affecting the exact same brain chemical, acetylcholine. This is known as anticholinergic burden. The more medications with anticholinergic effects you take together, the greater the total burden on your brain. Research suggests that a higher cumulative anticholinergic burden is associated with poorer memory, slower thinking, increased confusion, and a greater likelihood of cognitive decline in older adults. This is why medication reviews become increasingly important after age 60. Many people continue taking medications that were started years earlier. Some are no longer needed. Others may have safer alternatives available today. Even over-the-counter products can contribute to the overall burden without people realizing it. That's why one of the most valuable conversations you can have with your healthcare provider or pharmacist is a complete medication review. Bring every prescription, every over-the-counter medicine, every supplement. Ask one simple question. Do any of these medications affect memory, and are there safer options for me? Sometimes a single adjustment can make a meaningful difference, not because medications are bad, but because the right medication should support your health, not unintentionally work against it. Final thoughts. Growing older doesn't automatically mean losing your memory. Many factors influence brain health: regular physical activity, quality sleep, social connections, a nutritious diet, managing blood pressure and blood sugar, keeping your mind active, and yes, reviewing your medications from time to time. If today's video surprised you, don't panic. Never stop a prescription medication on your own. Instead, use this information as a starting point for an informed conversation with your healthcare provider. Small changes made early may help protect your quality of life for years to come. Now, I'd love to hear from you. Have you ever noticed brain fog or memory changes after starting a medication? Were you surprised by anything on today's list? Share your experience in the comments below. Someone reading your story may realize they're not alone. If you found this video helpful, give it a thumbs up, subscribe to the channel, and turn on notifications so you never miss our next video on healthy aging, nutrition, and practical wellness tips for adults over 60. Thanks for watching, and I'll see you in the next video.